Abu Muhammad is a diabetic who needs continuous medical care, but this 75-year-old can no longer afford it. Lebanon began gradually lifting subsidies on drugs a few months ago, but now they include those for chronic diseases.
I am a state employee, and my pension is not enough to pay for the medicines I need. We will die because we can't buy medicine.
Abu Muhammad left this pharmacy without the insulin he wanted. Medicine has now become a privilege for the majority of the population, made poor by an economic crisis.
Prices increased tenfold, and these drugs are essential and life-saving. The patient cannot stop taking them.
Living standards are falling fast in what is supposed to be a middle-income country. Many are now relying on local charities for healthcare services. A crash in the value of the local currency has made people's salaries nearly worthless.
Because we receive our salaries in Lebanese lira, we can't afford going to hospitals. We have to come to these centres instead.
The United Nations says there has been a 33% increase in households deprived of health care, and the share of those unable to buy medicines has increased to more than half. Lebanese officials are being criticized for failing to protect the poor by making essential goods like medicine more expensive by lifting subsidies. But the state is nearly bankrupt and lacks the foreign currency needed to import drugs. The health ministry says $130 million was being spent on medical supplies a month, and that's now down to $35 million. The international community has been helping with aid, but it's limited.
We chartered a special aircraft earlier this week and flew in 97 metric tons worth of basic supplies to help and to shore up the public system. But this will only last so long. We are seeing children dying needlessly from things like a fever. They didn't have the medications, or they weren't affordable for them. They weren't available in the health facilities when the children needed it the most.
Some medicines are given for free at government healthcare centers, and officials are promising locally produced drugs will soon be made available at lower prices. But for now, the lifting of subsidies is hurting those in need. Zeina, Khodr, Al Jazeera, Beirut.